What is pre-XDR TB in drug-resistant tuberculosis? Imagine a battle against a tiny but mighty enemy that has learned to dodge many of our best medicines. That enemy is a form of tuberculosis called pre-XDR TB. It is a type of drug-resistant tuberculosis caused by bacteria that have developed resistance to key drugs used to treat the disease. Specifically, these bacteria are resistant to the two most powerful first-line drugs, isoniazid and rifampicin. When bacteria resist these two drugs, it is called multidrug-resistant tuberculosis, or MDR-TB. But pre-XDR TB takes resistance a step further. It also shows resistance to either fluoroquinolones, which are strong antibiotics often used in second-line treatments, or to at least one of the three main injectable drugs used in treatment, which are amikacin, kanamycin, or capreomycin. This extra resistance makes pre-XDR TB harder to treat than MDR TB alone. Because the bacteria are resistant to more drugs, doctors have fewer options for effective medicines. This often means longer treatment times, sometimes up to 18 to 24 months, with more side effects and a higher chance that the treatment might not succeed. Patients with pre-XDR TB often have more severe lung damage, such as cavities or widespread lung involvement, and they face a greater risk of treatment failure or relapse. To clarify the terms, MDR-TB is when bacteria resist at least isoniazid and rifampicin. Pre-XDR-TB is when those bacteria also resist either fluoroquinolones or second-line injectable drugs. Extensively drug-resistant tuberculosis, or XDR-TB, is an even more resistant form where bacteria resist both fluoroquinolones and at least one of the newer drugs like bedaquiline or linezolid. The World Health Organization updated its definitions in 2021 to highlight that resistance to fluoroquinolones is a key marker for pre-XDR TB, signaling a more serious level of drug resistance. Detecting pre-XDR TB is crucial because it guides doctors in choosing the right treatment. Rapid and accurate drug susceptibility testing helps identify resistance patterns early, so patients can start the most effective regimens. This is important because standard MDR-TB treatments may not work well against pre-XDR TB, leading to longer, more complex, and more toxic treatment courses. Patients with pre-XDR TB often experience more severe symptoms, such as persistent cough, weight loss, and chest pain, and they are at higher risk of complications. From a public health perspective, understanding and identifying pre-XDR TB helps health authorities improve surveillance and develop better treatment strategies. It also emphasizes the importance of preventing the spread of resistant bacteria through proper diagnosis, treatment adherence, and infection control measures. In summary, pre-XDR TB is a more advanced form of drug-resistant tuberculosis that involves resistance to first-line drugs plus either fluoroquinolones or second-line injectable drugs. It presents significant challenges for treatment and control, making early detection and tailored therapy essential. If you or someone you know is dealing with tuberculosis, it is always best to consult healthcare professionals for personalized advice and appropriate testing.